Good morning, ladies and gentlemen. It is my pleasure today to make public my report, Government Programs Supporting Those in Need, which I recently submitted to the Legislative Assembly. I have with me today Martin Rubin, the audit principal responsible for the OAG's performance audit practice and this audit in particular. I will start by making some opening comments, which will be followed by an opportunity for you to ask questions about the report. This audit examined programs that deliver financial and other forms of social assistance to Caymanians. The main objectives of the audit was to determine whether these programs together and individually were managed in a manner that would enable the achievement of the desired outcomes and results, were deployed as components of a coordinated strategy to serve Caymanians in need of assistance, and whether this was done with due regard for value for money. We considered 12 such programs, including poor relief, seamen's and veterans benefits, and medical care for seamen's, veterans, and indigents. As my report indicates, the budget expenditure in 2013-14 for these areas was more than $50 million, or almost 10% of core government's expenditure, an increase of almost 30% since 2011-12. We carried out this audit because social assistance programs consume significant public resources, are an area of major socio-economic importance and great significance for many individuals and families who are directly or indirectly affected. In addition, several recent internal audits and reviews have identified serious shortcomings related to the governance, management, and delivery of several of these programs, supporting concerns raised by one of my predecessors well over a decade ago. Therefore, it is important for the Legislative Assembly and citizens to have assurance that the large sums of public money involved in these programs are well spent and that the programs are achieving the desired results. Turning now to the key findings in the report, we identified a number of significant issues which clearly demonstrate that government needs to do a lot more to ensure that social assistance programs are managed efficiently, effectively, and economically, and that they are delivering the appropriate outcomes for those in need. Whilst the establishment of the Needs Assessments Unit indicates government's desire to drive improvement, much more needs to be done to ensure that the significant public resources appropriated for social assistance programs are addressing the needs of those who require assistance in a systematic and equitable manner, and support the outcome goals of government. The key issues highlighted in the report include the following. There is no overall strategy that sets out the results being sought and the priorities to be pursued with more than $50 million of public funds appropriated to the social assistance programs. Without a focal point within the government with responsibility for oversight and coordination of social assistance policy, these programs are not coordinated to ensure a coherent approach to addressing current and emerging social needs. With respect to individual assistance programs, we found that they are operating without objectives and there is no measurement of their performance to provide a basis for taking corrective action as necessary and providing accountability to the Legislative Assembly. Government has therefore failed to ensure that the programs are helping those in need and achieving the desired results. Appropriate management control frameworks were not in place to help guide program delivery, safeguard resources, ensure compliance with authorities, and promote the achievement of desired results. One consequence is that the provision of social assistance through these programs is not always based on authoritative eligibility criteria that are transparent and defensible. In some instances, where criteria existed, they have been ignored or applied inconsistently. In this regard, we found clear evidence of assistance being provided to individuals on the basis of political direction rather than the application of defensible criteria. Although on a positive note, this has now been significantly reduced. Finally, the legislative framework is inadequate or does not provide or does not exist for 9 of the 12 programs that we examined. Legislative framework is a critical factor in setting out the desired objectives and goals to help those in need, providing the basis for sound management control, and ultimately in ensuring that there is backing for officials in the decisions that they make. In conclusion, my report indicates that government has not taken the necessary steps over the years to ensure it is providing assistance in the right amount to the right people at the right time, and thus ultimately failing the people they are supposed to be serving. There are no clear objectives of what government is trying to achieve, or in some cases, proper legislation that provides clear direction from the Legislative Assembly. As a result, government cannot manage these programs to achieve the desired outcomes or results, or provide effective accountability to the Legislative Assembly for this major portion of government expenditure. As a result of the deficiencies identified in my report, I have concluded that individual social assistance programs are not managed, and in the current circumstances, most of them cannot be managed with due regard to value for money. A greater and more concerted effort by government is required to address these issues and build on the initial steps that have been taken in establishing the Needs Assessment Unit. My report includes a number of recommendations for government action that is needed to develop a more strategic approach to the management of social assistance. In the coming years, I would like to be able to report that progress is being made by government to address the concerns raised in my report. Thank you for your attention, and I will now take any questions about this report.
Mr. Harris?
Thank you, gentlemen. Just a quick question. Just in your opening comments, you stated that from your researches, no overall strategy was identified and little to no overall oversight with regards to the social assistance programs. Can you say from your research how many persons not of Caymanian descent are receiving social welfare assistance?
That was not something that we specifically looked at. The reality is that most of these programs are directed towards Caymanians, so we didn't analyze it on that basis.
Thank you.
Just as a follow-on to that question, that when we did do our review of the samples that we selected, we did not find any that were non-Caymanian. Okay.
Good morning, gentlemen. Wendy from Cayman News Service. The political interference, are you willing to be a bit more precise?
In what
about which politicians interfered and how exactly? No, we don't. I don't have that data to my hand at this moment in time. What I can say is that over the 3 years that we looked at this, it decreased dramatically in terms of the amount of decisions that were politically directed. We didn't look into who specifically was looking at providing the direction. Okay.
Morning. Just to follow on from that as well. When we say political interference, was it that the technocrats were taking some of these cases to politicians themselves, or were the politicians going to the technocrats, or a bit of both?
Specifically, I couldn't exactly give you a clear answer on that. Generally, it's I think it was more likely the politicians going towards the civil servants when a decision was being made.
Morning, Carsley Fuller, Radio Cayman. I've sent some emails. Thank you for sending out your opening statement. So I have asked for government's response. But at this point, have you talked to anybody about whether or not they're going to be taking any of these recommendations on board?
If you look at the appendix to the report, Carsley, they've provided a clear response to the recommendations about they want to take action on that. The big question for me is whether they have the resources to be able to take the desired action, and that'll be the big question for them.
Thank you.
Hi, Charles Duncan with the Compass. The minimum wage report was very critical about the needs assessment unit and the level at which they provided assistance to people. Did that help inform this report at all?
Not the minimum wage report per se, because we'd already completed the majority of our work before that came out. What informed our work on this report was previous internal audit work, and also the public service review that was carried out in, I think it was 2011-12, which informed some of our work and provided the basis for us actually wanting to undertake this audit. So that provided us the initial direction regarding how we wanted to go. I think the clear message that comes out from our report is that whilst our report was broader in scope than any of the work that's previously been done, the same issues are still coming up. And that relates back to my predecessor back in 2001, who reported on similar matters as well, and the same issues are still apparent.
We also noted on page 24 in the report some issues that we found in the needs assessment unit regarding their own resourcing. That was when we conducted our work. We found that there were some concerns expressed by the unit itself about its ability to carry out its responsibilities with the resources it was allocated.
And I know you looked at a number of different units. Which need the most attention, in your opinion?
I think we were looking at this in broad terms about the overall need for social assistance and development of a coordinated and appropriate strategy for that, and ensuring that across the piece there was effective systems and practices in place to be able to manage that. So, and a lot of that's been driven through the needs assessment unit now. So, you know, it's difficult to say exactly where, but the needs assessment unit is probably one of the critical and key areas that needs to be addressed. The other critical area is to look at how the social assistance programs are split across various ministries and portfolios, and the challenge that makes in coordinating it and ensuring that all social needs are actually met effectively.
And did you find problems or any good signs of communication between ministries and between units?
That's really the issue that we've raised in our report, is that they're a bit isolated in terms of how they deal with each of the programs that they're responsible for, and there is no coordinated strategy in place. So our report talks about the fact that there is a need for a coordinated strategy by government, which would take into consideration each of those. So programs that are being offered by the different ministries at this time. So we see an opportunity there, and when we say, as the Auditor General mentioned in his opening comments, that there's a need for more strategic management of these programs, there needs to be what we believe is one strategy, because we're looking at effectively a population of individuals who need assistance from government, and if they all got together and understood what that assistance was that was needed, then it would be better. It could be better coordinated. What we were expecting to find was essentially a government strategy with respect to how these funds are spent, and that did not exist.
Obviously, normally your reports are focused on value for money and ensuring that, but in this case, we're also looking at a second element, which is that some people are getting and some people are not. Can you be a bit more specific about where you feel things have gone wrong for some people in their inability to access social need and social support because of this lack of specific criteria? Did it come to you any concerns that there are specific numbers of people that may be in dire need?
Wendy, that's I have to be honest, would be a huge task and undertaking to undertake. We were looking at the general environment and framework for ensuring that they can provide equitable and fair treatment of all individuals. And,
but you found they can't.
And that at the moment that's challenging, because, for example, if there's lack of clear criteria, it makes the decision making very subjective rather than based on objective criteria which everybody knows about and they know what they're entitled to. Until that's clearly in place, it's going to be very challenging at times for certain individuals to access the need that they may need, the funds they may need, and it's difficult for government to actually do that in an equitable manner.
I mean, you've made a lot of recommendations of different things, but all together in one big package. Are you saying that government needs to introduce a proper structured welfare system?
Well, that is one conclusion you could reach from in the report. They need to comprehensively look at what they're trying to deliver and how they're going to deliver it, and make sure that it's coordinated and a comprehensive strategy is what we're saying. Now, how that actually works out is there's a number of models they could actually develop. It needs to be up to them, and they could answer questions about whether it's tied into employment and things like that. So there's some big questions that need to be asked and then considered in doing this. But overall, they need to look at it in a coordinated fashion so they can ensure that, and put in the frameworks in place so they can ensure that people who are actually in need are getting the assistance they require. And that's actually also about knowing what your needs are and what the emerging trends are in terms of needs across the society. And at the moment, they don't have that clear information available to them about what the actual needs are across society.
For example, when we looked at some of the programs that were being offered, the criteria were based, for example, on family incomes. For one program, it was $2,000. For another program, it was $3,000. And those hadn't changed for many, many years. We asked the question, well, what should those numbers really be? Have you got evidence to support why you're using those numbers and not other numbers? And clearly, as the Auditor General just said, they haven't really gone out and determined what the needs are yet of the individuals that are getting funds from government for the programs that are being offered. So clearly what is needed is a review of what are those needs out there, who are the people that are getting or need the assistance from government, and how much do they really need in order to be supported in an appropriate way. At this point, those questions were left unanswered when we asked about the programs.
Well, for another example of a criteria is like the family income of whatever $2,000 or $3,000. But what does family mean in terms of the criteria? And that was interpreted sometimes as meaning just the applicant itself, the household applicant, rather than all adults in the household, for example. So, there was confusion about actual criteria that laid down because they weren't clearly specified.
Just a quick follow-up, because the government commissioned quite a few years ago now, I think it was the National Assessment of Living Conditions, where there was a lot of recommendations made about how to address issues. Did you see any evidence in your audit that anything was followed up from that, and that things were in place as a result of the National Assessment of Living Conditions?
We asked about action plans that government had in place for addressing the various reports that had been done previously, including the internal audit reports, their own review work that they did back in, I believe it was 2010-11. And any other reports that may have been done, and we didn't receive any kind of action plans, if you wish, or follow-ups to those reports per se. So that was a strong indication to us that we needed to go in and look at what the situation was as it was when we looked at it, and to determine whether or not there were additional recommendations that we could make beyond those reports, and reiterate some of those in our report as well, which, as you can probably tell, we did. So
I think you can take from the fact that things haven't changed for 10 years in terms of the programs, is that the National Living Assessment, I think it was done in 2006-07, really hasn't had an impact in terms of where the programs are at this stage, because the criteria haven't changed, and there's no new frameworks being put in place in that time. So, I think that's fairly indicative of where the situation has been.
It's important to note, though, Wendy, in responding, though, is that really the legislature needs to know what it's trying to do with funds. That they're responsible for the expenditure of public funds. So if there's no information going to them, and the legislature doesn't have legislation in place or hasn't passed legislation, appropriate legislation, to guide these programs and how they are to be delivered, we found 9 cases of 9 out of the 12 where either the legislation was either missing or it was insufficient to guide the administration in delivering these programs. It just leaves everything too open in terms of accountability for what government is actually trying to do in delivering these programs to the public.
When you talk about lack of resources, first of all, at the legislative framework level, is it the understanding that the information is not being properly communicated to the legislators so that they can thereafter put in place the necessary frameworks? Is there a lack of communication from the statutory or social services department on up to the political level? Is that where the bottleneck exists?
I think the reality is everyone knows the situation. I think there's been enough reports out there previously that indicate that like the public service review indicates some of the same issues. The previous internal audit reports have raised some of these. So the ministries are aware of it and up to the political level, from my understanding. The question mark as well is that the priority of taking this as new legislation being taken to the Legislative Assembly. So hopefully, in due course, action will be taken to ensure that they have got the appropriate legislative frameworks. That does require the political will to take that forward.
Your report says that the $50 million accounted for the 12 social assistance programs accounts for almost 10% of government expenditure, or government revenue, excuse me.
Core government
expenditure.
With no information coming from these 12 programs to the legislative level, how are budgets allocated one year for the next?
Based on
do we guess?
Historical basis.
That's our concern, is that when the legislature does get these requests for funding through appropriation acts and whatnot, that there be proper information to guide them as to what they're trying to deliver with these amounts. We did not find, for example, how those numbers are supported in effect, except by the numbers that they expect to help they do provide that, and as well the average amounts that are being spent on each of those individuals. But after that, there's no real strategy supporting it.
It comes back to that assessment of need. What is the true assessment of need across the community for social assistance, and how they can actually effectively budget for that. And the reality is they haven't done that clear assessment of the needs out there for them to actually identify what programs are required and what level of funding is required to deliver those programs. So it goes back to basics and starting from first principles to an extent.
The last question. When you talk about lack of resources, do those lack of resources at the departmental level include a lack of human capital resources, or is it just a lack of proper record keeping as audit report after audit report after audit report indicates?
We're talking about the human capital mainly, because what we have identified that through the needs assessment unit, the documentation and has improved, and the quality of that has improved, because we had significant issues with earlier cases where we couldn't find any documentation to support the payments that were being made, but historically, but nowadays with the needs assessment unit, they have got good documentation that supports the payments and the transactions that are being carried. But the reality is the human capital to deal with all the requests, to deal with all the processing and administration of the social assistance programs is a challenge for them at this moment in time.
Is there any concern that this might be deliberate misappropriation in some instances? Or do you think it's just that they just don't know what they're doing, they don't have the proper criteria, or they're just handing it out?
I can't speculate about the motives around this. All I can say is what we found is that there is no clear criteria and for a lot of the programs, which makes things very difficult and obfuscates the decision-making process. So, we don't. It's not for me to speculate about motivations. I'm here to present the objective facts.
I know this isn't a value for money audit, but is there a ball?
It is
a value for money
it
audit.
is. Okay,
Yeah.
therefore, can you put a dollar value as to how much money we're talking about that's been spent unnecessarily or otherwise?
That's practically impossible in terms of putting a dollar amount on this. And all we can say is that we can say that those in need haven't necessarily received the money they received at the right time. That's the key answer at the end of the day. We can say that those who are in need haven't received the assistance they need at the right time.
But the amount of money we're talking about here that has gone where it shouldn't have gone, so on and so forth, are we talking thousands, tens of thousands, hundreds of thousands,
Who knows?
millions?
But Tammy, ultimately, the question marks is what are the needs? Until you really know what your needs are, it's difficult to know and assess that, and that will take a bit of work to essentially. Ultimately, the need might be greater. It might not be less. It might be greater. But it might not be directed in the right way at this moment in time. That's the
So
challenge.
you couldn't do your job properly here because the information simply wasn't there.
I think, well, maybe an element of that, but the reality is this is a very difficult area to actually assess value in that sense. You can see where there are issues. You could potentially do an assessment of whether there's any fraud and error in the benefits in the system of social assistance. But to actually identify what has been wasted is very challenging.
Once again, you'll find in our report, there's in our sampling of the actual payments, many of the payments, when we went back to the files, had very little information supporting those payments. So, and some didn't even have a file at all. So the question you've asked, Tammy, which I think is a good one, is, government should know that when they're making those payments, that there is at least evidence that those payments are being made at least in accordance with the program framework that is being designed by government, at least at this time, and that they're going for the purpose for which they were intended. And when we did our testing, we found in many cases those files simply did not exist. So, that's a strong indication that many of those payments may not be appropriate. But that's only an indication. We don't have any hard evidence to say that someone received payments that should not have received.
And another factor is that because of the resource issue, they don't have the resources to actually continue to follow up on the people that are receiving payments on a regular basis. So there's no mechanisms to ensure that those people who are receiving support are still in need of support. So it's difficult for them to actually assess that issue. So having that data not being available makes it a challenge to assess that as well. If there are any more questions, thank you very much. A couple of minutes.